Good afternoon, everyone. We want to welcome you to our 90th extension of Community Healthcare Outcome Session, HIV and TB. In particular, we want to welcome our colleagues joining us from Luapula, Copperbelt Province, Muchinga Province, Northern Province, Northwestern Province, and Central Province. We want to thank you for joining us. We acknowledge we need to support these provinces more because they have just started joining the extensions, and we want to focus on these provinces. Here in the hub, we have me. My name is Sombo Foloshi. I'm an ID physician. I am joined in the hub by Louisa, Arnold, and Faith. These are our nurses from our Pediatric Center of Excellence, just down here, where the hub is hosted. Our topic today is mental health in HIV with introduction of CETA. Last week, we had Dr. Albert Mwango, who talked about dolutegravir in pregnancy, issues about dolutegravir in pregnancy. I think the key messages were dolutegravir protects the health of the mother. I'm having background noise. Dolutegravir protects the health of the mother. The neurotube defect risk from dolutegravir is very low. Dolutegravir prevents transmission of HIV to the child. Dolutegravir reduces viral load faster than efavirenz. Pregnancy and birth outcomes need to be monitored for patients on dolutegravir. But even more importantly is if you are seeing a woman who's already pregnant, at this time, the risk is zero as the neurotube would have formed, especially if you're talking about 28 days after we see a woman. So dolutegravir is actually the recommended first-line treatment for pregnant women in Zambia. With that said, we want to welcome Dr. Francis Simenda. Please go ahead and share your screen. Consultant psychiatrist. And this is a privilege for us because he was one of the pioneers in the clinical mentorship program in Zambia. He was the first lead mentor for Southern Province. Dr. Francis Simenda, please go ahead and share your screen.
Thank you, and good afternoon.
Good afternoon. Join me.
Is it visible now?
I see your slides. Thank you. Please.
Okay. Let me just. Good afternoon to all joining us this afternoon in the ECHO session. I'll be presenting on mental health in HIV. My first slide shows. So the learning objectives today, we're going to, number one, describe the common psychosocial conditions in people living with HIV. Two, elaborate the effect of mental health issues on the quality of life with people living with HIV and the success of antiretroviral therapy. Number three, we're going to characterize mental health issues in people living with HIV. Number four, explore issues in mental health and antiretroviral ARVs. Number five, we're going to introduce a treatment we call the Common Elements Treatment Approach, CETA. We have the first polling question. May I go ahead and read it? So, regarding mental health, the following statements are true. A, mental health is also referred to as mental disorders. B, mental health is a result of disequilibrium between thinking, behavior, and emotional states. C, psychiatric disorders are synonymous with mental disorders. D, mental health include psychological, emotional, and social well-being affecting how we feel, think, behave at all stages of our lifespan. E, HIV-associated dementia is the commonest mental disorder in HIV disease.
Thank you so much, Dr. Simenda, for that. We are going to launch the poll. Please feel free to vote. You may need to, okay. So regarding mental health, the following statements are true. A, mental health is also referred to as mental disorders. B, mental health is the result of disequilibrium between thinking, behavior, and emotional states. C, psychiatric disorders are synonymous with mental disorders, meaning psychiatric disorders are the same as mental disorders. D, mental health includes psychological, emotional, and social well-being affecting how we feel, think, behave at all stages of our lifespan. E, HIV-associated dementia is the commonest mental disorder in HIV disease. Dr. Simenda, very interesting polling. I don't know if you're privy to this poll, but we have some interesting results. Some people feel that mental health is also referred to as, is equal to a mental disorder. Mental health is the result of disequilibrium between thinking, behavior, and emotional states. Some people actually feel that psychiatric disorders are the same as mental disorders. While 77% feel that mental health includes psychological, emotional, and social well-being affecting how we feel, think, behave at all stages of our lifespan. Some people feel HIV-associated dementia is the commonest mental disorder in HIV. We will go ahead and end the poll at this point. Dr. Simenda, this is how the voting was.
Thank you so much.
Yes, please go ahead.
Should I comment on the results?
Next, I will do it at the end. Thank you.
Thank you. It's an interesting pattern of responses.
Please go ahead.
We proceed?
Yes, please.
Yes. Are we getting stuck? Okay. Sorry about that. So in this slide, we define mental health according to the two major bodies of global health. According to WHO, mental health is a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution to his or her community. In the CDC, mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescent through adulthood. So those are the two key descriptions or definitions that are trending in the world today regarding the definition of mental health. Now, in thinking about what are mental disorders, so to conceptualize mental disorders, we describe as a disequilibrium between the thoughts, that is the thoughts that we have, actions, and affect. In technical terms, we're talking about cognition, connection, and affect. So a disbalance or mismatch between these factors in a person can result in a mental disorder. What are the categories of HIV and AIDS-related mental disorders that we observe in our facilities? We encounter recipients of care with a primary psychiatric